This is Doodle News Network, and I am your host, Dirk Doodle. Welcome back to another Science Digest. In today's news, we're exploring the potential risks of private equity ownership in hospitals, the intriguing link between gut microbes and social anxiety, and the impact of spanking on children's cognitive skills. We're also delving into the fascinating world of reindeer and their night vision capabilities, and discussing a promising midlife blood test that could predict Alzheimer's. Stay tuned for these exciting stories. Researchers have discovered that gut microbes may play a significant role in social anxiety disorder, SAD. The gut microbiome, the collection of bacteria and organisms in our gastrointestinal system, has been found to differ between individuals with SAD and those without. In a study, when microbes from the guts of people with SAD were transplanted into mice, the mice showed an increased response to social fear. The mice with SAD gut microbes also behaved differently after a social fear experiment, continuing to show fear of approaching other mice. The study suggests that the gut microbiome can influence social fear responses in SAD, opening up new possibilities for therapies. The main point is, we need to look after our microbes, especially throughout development and even in adulthood, to keep the social brain working appropriately, said Prof. John Cryan, a co-author of the research. Researchers at the University of Michigan have discovered a potential method for early detection of Alzheimer's disease and other dementias through a midlife blood test. The study focused on two blood biomarkers, amyloid beta-42 over 40 ratio and phosphorylated tau 181, and found that higher levels of phosphorylated tau 181 and lower amyloid beta-42 over 40 levels were associated with faster cognitive decline. The research, which involved 192 middle-aged women over 14 years, suggests that these biomarkers could serve as early predictors of cognitive decline. However, the researchers stress that the presence of these biomarkers does not necessarily indicate Alzheimer's disease. These pathological changes are important to know of earlier than later, said Xin Wang, a research assistant professor in the Department of Epidemiology at the University of Michigan School of Public Health. The team hopes that these blood tests could provide a less invasive and potentially more affordable alternative to current neurological testing methods. A recent study published in the journal JAMA reveals that patient care became riskier at hospitals purchased by private equity firms. The study analyzed nearly 5 million hospitalizations and found that rates of hospital-acquired complications for patients increased by 25% at hospitals after they were bought by private equity firms. The increase was driven by a 27% rise in falls, a 38% increase in central line infections, and a doubling of the rates of surgical site infections. The study's author, Dr. Zirui Song, suggests that these acquisitions often lead to staff cuts and the replacement of highly paid workers, such as doctors and nurses, with lower-paid employees. In all three so-called layers of the hospital, from the general floors to the ICUs to the operating rooms, we saw a quite striking and concerning average change, said Song. The study also noted a slight shift in patient demographics at private equity-owned hospitals, with a trend towards treating fewer low-income patients. Reindeer have a unique form of night vision that helps them find food in the winter, according to a study led by Prof. Nathaniel Dominy of Dartmouth College and researchers from the University of St. Andrews. The reindeer's eyes change color seasonally, turning blue in winter, which allows them to transmit ultraviolet light. This adaptation helps them see clearly in the dark and find food, such as lichen, in the snow. To reindeer eyes, the species they need to feed on would stand out as dark patches in the much more reflective snowy landscape, said Dr. Catherine Hobater of the University of St. Andrews. The researchers also found that reindeer moss, a lichen vital to reindeer survival, absorbs UV light strongly, making it easier for reindeer to spot in the snow. A recent study published in Child Abuse and Neglect has found that spanking is associated with lower levels of executive functioning in children, such as inhibitory control and cognitive flexibility. The study analyzed data from over 12,000 children and found that even infrequent spanking can negatively impact a child's cognitive development. The researchers found no association between spanking and working memory, but the negative effects on inhibitory control and cognitive flexibility persisted. The study's author, Jae-Hai Kang, stated, We found that exposure to spanking at age 5 was negatively related to children's ability to deliberately regulate action, called inhibitory control, and adaptively shift between tasks, called cognitive flexibility, at age 6, irrespective of child gender, race, and parental warmth. The study suggests that the negative impacts of spanking are consistent across different demographics and family contexts. That's it for this week's fill of news from the world of science. Let me know in the comments which story you liked best. Also, if you enjoyed the content, please like the video and consider subscribing. See you next week!